All right, well, thanks for coming and thanks for having me here. This is a talk that Dr. Ivy Lee was going to give, but I have worked closely on developing these tools, so I'm very comfortable giving this talk. So Ivy submitted an abstract to discuss the resources that we've been developing through the American Academy of Dermatology to help practitioners to learn about teledermatology. So the first question is, why would we want to do this? Why do we need to teach dermatologists specifically about teledermatology? And I think the biggest question, the biggest reason has been the expanded practice that we have seen. Teledermatology has really exploded in the US and I think really globally. Some of our biggest organizations have expanded through telemedicine. Kaiser is a large healthcare system in the US. The Veterans Affairs, which you heard about earlier today, has a very large telemedicine system. And now, as I've shown you here, a lot of our urgent care systems, even our Walgreens and our CVS, which are our drugstores, have telemedicine available to them through commercial and retail clinics. And so it's really rapidly expanding in the US and also in many other developed countries and globally in developing countries. And so our residents and even our dermatologists are coming across opportunities to practice teledermatology, and I don't think we really have trained them very well. And so, you know, they're kind of just learning by doing in a lot of circumstances, and we really felt that it was important not only to teach them how to do telemedicine, because those of you in the room that do it know there is a certain skill to it, and understanding what you're looking for and what you need to ask about, but also understanding what good telemedicine is. So that brings us to the next slide, which is quality. There is such a huge spectrum as to quality of telemedicine, and I think Karen talked a little bit about it, but you know, it's sort of a moving target right now. How do we define quality? We've been trying to think more about that question and what are the things we need to look at in terms of defining quality telemedicine, and how does quality telemedicine compare to in-person care, or should those two things even be compared? Are they completely different things? And how do we promote quality telemedicine or measure quality telemedicine? And so the AAD, or American Academy of Dermatology's answer to these things was, I think the best way to help our dermatologists, not only in the US or our AAD members, but anybody practicing dermatology worldwide, would be to provide tools to help them to learn more about teledermatology. Karen mentioned we do have a position statement. It's not a full guideline like the ATA, but it's a position statement. It's a couple pages long. It's been revised more times than I can even remember because I've been the one helping to do that. People always want to put their 2 cents in and have some more revisions, so now we do it annually. But it just has some main guidelines on what good telemedicine is. But now we're working to an online curriculum that'll help dermatologists know what good quality telemedicine is, what all of these other, I'll get to the details of it, but how to do and practice telemedicine in your setting. So we just launched the toolkit and the online quiz and the online how to do telemedicine and resources will be launched at the AAD meeting in March. But the main screen is actually online now, and these are the main buttons that you can click on. Some people, at least in my department, don't even know what telemedicine is yet. In fact, one of our main people in our department just last year is like, what do you do, Skype with your patients? And I'm like, oh my gosh, still, you know, we have so many people in my department that do telemedicine. And I'm like, so many things are wrong with the thing you just said to me, you know, like Skype, it's not HIPAA compliant. No, I don't do it directly to my patients. So what are we talking about here? So we need to just, what is telemedicine for some people? Go back to the basics. Some people want some help with choosing a vendor. We're not doing vendor specifics, but we're kind of going through some guidelines of what to look for when looking for a vendor, depending on what you want to do. Compliance with certain things like HIPAA, and then we're going to MACRA and all these things that are US specific, but some help with compliance with guidelines, how to implement it. So each practice is very specific, and really what I do a lot with our AAD members is help them with customizing to certain practices. So people will call me and say, you know, my last one was, I'm a dermatologist in a multi-specialty clinic. Our internal medicine doctors are less than excited about doing this, but they just want to just throw all their patients to us, but we think teledermatology could be helpful with triage, and how do we get this implemented and increase their motivation? You know, we're trying to help with flow and where to put it, and should we implement it in their EHR, and kind of trying to think about those questions. Access Derm is our volunteer platform, so we've implemented this. It's the AAD's platform. We've implemented it in 15 clinics in Philadelphia. It's a free mobile and web-based teledermatology platform for underserved patients. It's in the city health clinics in Philadelphia, and it's free to all of our members who want to implement it. So the position statement for the AAD addresses all of these things, such as licensure, patient choice, which is very important. We feel it's important that patients who get care through teledermatology, whether it's provider to provider or direct to provider, should have a choice on who their doctor is. Just like if you walked into an office, you should be able to pick who your doctor is. In teledermatology, medical history needs to be available. You need to coordinate care with primary care physicians and other parts of the medical team. That visit needs to be documented, believe it or not. Like I said, there's a spectrum out there. There's many teledermatology practices, especially direct to patient, who don't document almost anything. And then quality assurance, whoever's doing teledermatology needs to make sure they look back at their cases and that things you know, are going well. And the patient-provider relationship is, in the US, it's sort of dictated by law on what needs to be done. Karen brought this up. I was part of this study with others, and really it came down to the issue that there's such again, a spectrum in the direct-to-patient or consumer care throughout the world, but particularly in the US, that we felt that it was necessary to sort of do it was sort of a secret shopper sort of a study. You can read about it. We got a lot of slack for this study, but the reality was people were not going to take a step back and look at the quality of their services unless something was done that got a little bit of press. And in the end, two groups had international physicians with no licenses practicing dermatology in the US. Most of them didn't raise concerns that all of these were false names and photographs. 68% of the patients didn't have a choice of clinician. Very few sent records to the PCP. Most of them didn't give any information about possible side effects of drugs, including pregnancy possible side effects. And it really wasn't about the fact that a lot of the diagnoses were missed, and that's not even the big thing. It was really about the fact that we needed quality care in terms of just basic medicine, basic medical care, like we have in the office. And in terms of filling the research gaps, I had asked a question this morning that we really need more outcome data. We have good concordance data out there, and you can see we're a little bit lower than some specialties. We have good concordance data, good patient satisfaction data, but where we lag with other specialties is in the outcomes data. And so here's our curriculum. We really tried to think of everything that we would want to teach a dermatologist or a dermatology trainee. This is all online. There's 4 modules. Some are longer than others. We will be updating this regularly because, as you know, everything just advances so rapidly. Technology will be one, so it's starting really basic. To regulations and liability. So there will be some things that are US specific, like laws and things like that. Medical legal risk, utilization, so thinking about quality assessment, what people have done to sort of check themselves, and then ethics as well. There will be CME offered, and for the US people, we're trying to get mock our maintenance of certification, which is kind of a pain. So practice management resources, again, like I said, getting started. We have resources on how people may want to get started with telemedicine. A lot of people are kind of fearful of this because we're not teaching it that much in residency. And so they graduate, they get out there. Some of these companies start asking them to practice. I had one of my colleagues actually was emailed by one of these direct-to-consumer companies saying, I have the emails, he kept forwarding them to me. It said, dear Dr. So-and-so, when would you like to set up a call to discuss coming on board with us? One day later, Dr. So-and-so, I didn't hear back from you. I assume you didn't get my email. When would you like to discuss coming on board with us to provide Telederm? 2 days later, Dr. So-and-so. These are the reasons why you should, I'm thinking, this is really heavy-hitting, aggressive marketing. But anyway, some of our residents are actually getting into telemedicine, and they should be equipped to do this. Quality assessment, we also need to make sure we integrate this into our telemedicine platforms, and that if you're a dermatologist that's put in this position, whether you've learned about it or not, you should know some options. So there are 2 papers, one actually from New Zealand about doing quality. So either performance reporting, outcomes data, user feedback. There are a couple ways to do this. Randomly select cases, see how the patients are doing. And so again, these are sort of some of the AAD's goals, and really we're trying to take those into account and better teach our members and residents on how to use teledermatology. So thank you.